If you're wondering about Medicare and what it is and different options and plans for you or your loved one, and you're around 65, this episode is for you. Stay tuned. We have two special guests who are Medicare specialists who are going to help clear the mud of Medicare. All right. Thank you, Charlotte family, for tuning in. Today, we got two special guests, David Ireland and Lamonica Thomas. We're going to talk about today specifically Medicare education. So thank you both, David and Lamonica, for tuning in and basically making time for us to make sure we talk about Medicare in general and how it helps our population. David Ireland is a marketing director with the Brokerage Inc. He started in Medicare business 11 years ago as an agent, worked as an agent manager with a large carrier, and now supports independent agents and agencies. So thank you, David, so much for coming on board with us today.
I'm glad to be here.
And then we also got Lamonica Thomas. Lamonica Thomas is a licensed Medicare specialist. She's been in the Medicare business for 9 years, actually a Medicare broker, which means she represents different Medicare insurance carriers in order to help her clients find the best plan for their needs. Thank you so much, Lamonica, for coming on board today.
Thanks for having me.
One of the biggest things we want to talk about, and the things that we've seen, I'm sure both of you all have seen over the years, is that the process of applying for Medicare when you turn 65. Lamonica, kind of walk us through, say, for instance, I turned 65 and I need to start that process. What do I do?
Okay, so let's just kind of quickly walk through what is Medicare. So Medicare is a national healthcare program offered through our government. You know, if you're disabled or turning 65, you qualify for Medicare. Medicare has two parts, parts A and B. And normally, if we've worked all through our lives, we will receive Part A at zero cost, but we are, responsible for Part B, which is a monthly premium that we must pay. Now, the current cost for Part B for most people is around $144.60. So you must pay this amount every month. And everybody's a little different. Some people may already be drawing Social Security and then are about to turn 65. So if you are drawing Social Security already, you will automatically start your Medicare. Medicare will contact you. They'll send you that red, white, and blue card with your Parts A and B once you turn 65. Now, people who are disabled, because a lot of people sometimes, depending on their health, has to, they have to start their Social Security benefits early or their disability benefits early. And when that happens, after they've been receiving their SSI benefits after 2 years, they will also usually will automatically go on Medicare and again, start with the red, white, and blue card with Parts A and B. Yeah, so that's how it normally happens. But for a lot of people, when you're, like you said, you're 64 and a half and you're thinking, okay, I want to start my Medicare. So usually there are two options. Most people will go to the Social Security office. But again, obviously with the COVID-19 pandemic going on, and when government offices are closed, then they're going to encourage you and almost make it mandatory. You have to do it online. So you can go to www.ssa.gov. And as soon as you pull up that page, you'll see it, Medicare. You just click on the Medicare box, click on Medicare only, and it walks you through the steps that you need to follow, because you have to create your own account if you haven't done so in the past. And it'll walk you through how to apply for your Medicare card.
Well, that's good to know. So sometimes, these steps can be a little confusing, but it's good to know that at least there's a website that you can go to and click and kind of walk you through that process, especially like you were mentioning with the COVID-19 and all the restrictions,
Yes.
That's tough. I appreciate that. What are some, David, if you may, what are some of the different plans for Medicare? Can you walk us through the different types of plans?
Sure. So Lamonica just gave a good explanation about original Medicare. So when she referred to Medicare Parts A and B. That's original Medicare, and that's going to be the first step.
Okay.
From there, there's a couple of different types of plans you can then get. One is a Medicare supplement. That's going to be like Plan F or Plan G. There's also standalone Part D plans, also known as PDP. I try not to use too many acronyms because this is all confusing anyway, but the Part D plans are prescription drug plans. And then there's also Medicare Advantage plans, which are also known as Medicare Part C.
Okay.
So basically, once you have your original Medicare, you can either add on a supplement and or a standalone Part D drug plan, or you can get a Medicare Advantage plan, but you can't get both.
Gotcha.
So Medicare Advantage plans include Part D. Well, let me say most Medicare Advantage plans include your Part D prescription drug coverage, along with some additional benefits you don't get with original Medicare, like vision, hearing, dental in some cases. And they come with a very low premium. Some of these plans are as low as $0 per month. Medicare supplements and standalone drug plans are more expensive. They do come with a monthly premium that you pay every month on top of that Part B premium that Lamonica mentioned. But if you have high utilization, meaning if you go to the doctor a lot, if you have some serious health issues, you have some expensive treatments, then that route might make sense for you to get that type of plan and pay the higher premiums.
Okay. So it all depends on how much you're spending on healthcare and what plan really fits for you, correct?
Yeah, that's one way to look at it. There's a few deciding factors that most people use. We find it. One is budget.
Okay.
Another one is your general health. Now, not all of these plans can discriminate based on your health, but as far as how healthy you are or aren't might be a good indicator of which type of plan you want to go in. And then the third is your doctors.
And making sure that they have the same in-network, correct?
Right.
Okay.
So if you have some doctors that you absolutely want to continue to see, there's no way you would consider ever changing from that doctor. Hopefully that doctor doesn't retire.
Yeah.
But while they're still working, we want to make sure that those doctors that you absolutely will not give up, we want to make sure that you're in a plan that they will accept.
Good. Okay. That's good to know. One of the things that we see a lot is what is the cost? What is the cost of these plans or anything in general? Lamonica, if you could kind of maybe speak on some things regarding how do I get my biggest bang for my buck, basically, when it comes to Medicare plans, or what do you look at to come up with that decision?
Okay, well, kind of like piggybacking off what David said, it really, you have to determine what your needs are, because, when you're turning 65, you're going to get all these different, advertisements in the mail. It's going to tell you this plan is great for you, this plan is better for you, this plan is this. But you have to really have a realistic talk with yourself and say, okay, these are my medical needs. I've got to, determine what am I looking for in a Medicare plan. As David had said earlier, it's about certain relationships with doctors, relationships with networks. You may find out when you turn 65, because like David said, a doctor could be retiring, but you may find out that doctor will not take Medicare. So then you have to make the determination, well, gee, that's going to end my relationship with him. So what do I do? So you have to kind of get prepared for that transition from maybe a group employer plan to a Medicare plan. So you definitely want to find out that doctor relationship. If it is important, you want to find out what your doctor's plans are. Hopefully, if they are going to accept Medicare, then you will find out what plans that practice takes, what the network takes. If you have the discretionary income to consider maybe a Medicare supplement, you want to take a look at that. Your health, as David said, plays an important factor. If you're, pretty healthy, maybe you don't want to start spending that amount each month, when a Medicare Advantage plan might be a a better fit or a good fit where you don't have to worry about a monthly premium. So these are questions. And then it's not just in the beginning when you start Medicare. These are questions you're going to have to ask yourself every year. You always want to do annual reviews with your plan because plans change. You know, the benefits that they offer change. The formulary in a prescription drug portion of a plan can change. You may have a medicine that you're taking where they have it 1 year and then the next year in the new plan, it may not be on the formulary. So it's really just part of a job. You know, this is a new job, new gig, you know, and your job is to stay on point to be sure you're keeping up with it, whether it's you or a loved one working with you to be sure everything stays on track so that you can continue a great quality of life, you know, while you're on Medicare.
That's good. That's good. And that's so good to know because, you know, at times it can be, you know, frustrating to figure out what is the best, you know, plan for my loved one, or say, for instance, you know, my grandparent or my mom or dad or, you know, or myself, you know, we're trying to figure out what is the best plan for us. And David, what would you say? What's the best way to go about doing that?
Yeah, so that's a really good point. A lot of people listening and just a lot of people in general who have to get into this world of Medicare and trying to figure it all out might not even be on Medicare themselves. Maybe they have a parent or a loved one or a friend or a neighbor that maybe needs a little bit of help. They're on Medicare and they're not sure. So, I mean, I would say, first of all, Lamonica and I obviously think a lot alike because we're going to have a lot of the same type of things to say. But really, the best thing to do is have them review their current plan. They may have signed up for this plan that they're on years and years ago. Maybe they had a really experienced agent help them with it, and maybe it was the best plan at the time for their needs. Maybe it still is the best plan for them, but since plans change every year, you won't know for sure unless you review it. So an honest agent will tell you if you're already in the right plan. If there is possibly a better option, they're going to make some recommendations for alternative options where appropriate. So the plan benefits change every year. You sign up for a plan 1 year, some of the copays change a little bit each year. The provider networks, doctors may be bought out by a hospital system that accepts different plans, and it's no longer in their control as far as what plans they'll take. Your doctors might change. The medications that you take might change. Plan formularies, which that's the list of the covered medications and how much you're responsible to pay when you fill those prescriptions. It all changes every year. So somebody like Lamonica will probably contact you. If she signed you up on a plan, she'll contact you before the annual enrollment period every year and say, hey, let's just do a quick review. Let's see, you know, what's changed. There's a new plan that entered the market that I think might be good for you. Or she might say, you know, you're still in the best plan for you. If you did sign up for your plan with a licensed agent, then they should be contacting you to do a review. But typically that doesn't happen. So don't be scared to reach out and just have somebody take a look at it. Because, you know, what once may have been best might not be anymore.
You know, I appreciate you saying that because, you know, it's as simple as almost saying, you know, when you have a phone bill and you have a wireless phone bill, those plans change every year or even sometimes quicker than that. And if you don't review
if
you don't look at it, then you'll get the bill and you'll be like, oh, whoa, I did not know that changed. But having someone that is, you know, a specialist in that to walk you through that really kind of eases that burden or that worry about what is going on in this specific realm. Or are there any specific like times in the year where you could change plans, or can you walk us through that a little bit, David?
Sure. So every year there's something called the Medicare annual enrollment period. That runs from October 15th through December 7th every year. And if you're on Medicare or if you're about to be, you can't miss it. You're going to know that it is the time of year to be able to change your plan if you want to, because your mailbox is going to be overflowing every day. Every time you turn on the TV, you're going to see Medicare plan commercials. So during that time of year is when everybody on Medicare can make a change to their plan. They can change from one Advantage plan to another, or they can change from an Advantage to a supplement, or change their standalone drug plan. Any change they want to make can happen that time of the year. And then the new plan takes effect January 1st. Now, typically you're locked in to your plan for that year. And then next year, if you want to make a change, you can do so during that next annual enrollment period. If you're happy with your plan and there's no reason to change, you don't have to do anything. You're automatically re-enrolled each year.
Okay.
So some people, though, do have the option to change their plan throughout the year. So there's something called special election periods. That's going to be things like, let's say that you have Medicare and Medicaid. You can change your plan throughout the year. Or maybe you don't have Medicaid, but you do receive some kind of state assistance, a low-income subsidy, also known as extra help paying for prescription drugs. Maybe you retire, you're working past 65 and you retire in the middle of the year, or you move out of your city or out of your state. Lots of things like that allow you to change your plan throughout the year.
Okay. That makes sense. It's good to know kind of where can those changes be made, and is there like a website or something that someone can go to just so they're aware?
Sure. So Medicare.gov is full of all kinds of useful information. Sometimes it can be information overload, and it might be kind of hard to find where those special election periods are. But the information is certainly out there.
Good to know.
Yeah. It's also interesting too. One of the things, like when you were asking about trying to make sure your loved ones have the best plan, whether it's like an adult child helping, a Medicare beneficiary, it's very important that whatever you guys agree upon, that it stays that way. Because sometimes when seniors, especially if seniors live alone, they get so many phone calls. Like David said, you get so many things in the mail, but you also get so many phone calls, and you get some of these predatory agents who will, you say yes to maybe you wanting dental, and then you just said yes to a whole new plan. And the next thing you know, they've signed you up on a new Medicare Advantage plan. You go to the doctor doesn't accept it. And then you've got to figure out, well, how can I get back on my old plan? So you really have to be careful, especially as seniors. They just have to be so careful when they get these calls from different Medicare Advantage companies, because they're all after your business.
Yeah, that's good to know. That's good to know. What are for seniors and just in general, what are some services that are offered and eligible for Medicare? Lamonica, if you mind just touching base on that.
Yeah, so obviously there are a lot of great benefits offered through Medicare, but keep in mind, again, Medicare Parts A and B will cover 80% of most hospital doctor outpatient services. But some of the other benefits will include hospital meals, skilled nursing services, intensive care, medical supplies, medical equipment, lab tests, blood transfusions, home health care, hospice, lab services, mental care, ambulance and emergency services, so much, much more. But again, it's 80% of that cost. So you are responsible as a senior, as a Medicare beneficiary, you're responsible for that 20%. And in the scope of things, 20% may not sound like a lot, but if something catastrophic happens, I had one client who had a heart attack. He was just on original Medicare, had Parts A and B, and had a heart attack and didn't realize that his 20%, his portion, added up to over $53,000.
Oh, wow.
And so that wiped him out. That took all of his savings. And just such a blow when it doesn't have to be that way.
Mm.
So it really is, education is so important, because sometimes people also have, as adults, if our best friend says, you know what, I tried this and I don't like it, I don't think you're going to like it either. You may get it in your mind, well, I don't like Medicare Advantage plans, and I don't like Medicare supplement plans. And so it's our job to help at least get them to sit down long enough to be open-minded,
Right.
and let us explain,
Right.
Let us explain how the plan can benefit you.
Right.
So.
Monica, can you think of a good, even a good scenario as well, like in terms of, where that plan really covered that 20%, or just kind of an example for our viewers that would, regarding?
So let's say that same gentleman who had the heart attack and ended up paying $53,000. Let's say he had been on a Medicare Advantage plan. And with Medicare Advantage plans, there are basically two options. There's an HMO plan or a PPO plan.
Okay.
PPOs tend to have a little more of an out-of-pocket cost. But if he had been just on a Medicare PPO plan, Medicare PPO Advantage plan, the most he would have paid is $6,700, which is a lot better than $53,000.
I agree.
Okay. Yeah. Yeah. So it can make a difference. It really can.
That's good to know. So another thing that's frustrating for everyone, of course, is bills and getting overcharged, or just getting a bill in the mail and being like, what is this for? Like, why am I getting this? Like, what is this about? Can you walk us through why sometimes clients or patients get overcharged or get those bills, and just walk us through that?
Sure, I can take that one. Bills are always frustrating, even if you're expecting it, right? So yeah, sometimes you can get an unexpected bill that just makes your eyes pop out of your head. Now, sometimes it's just a simple mistake. So the most common reason we see for these unexpected bills is from coding errors. So as you've probably been able to tell so far, that insurance and Medicare is kind of confusing. So there's a whole nother level on the back end that consists of a whole lot of codes. So every time you go to a doctor or a hospital or have a medical service, there's a code associated with that. And oftentimes it's multiple codes. It's usually not just going to be one code. So that provider submits these codes to either the insurance company or to Medicare for reimbursement. And sometimes people make mistakes. So it could result in overcharging or even a flat out claim denial. So what we recommend is, if you get an unexpected bill, call that number and just ask, why is this amount different than what I thought? It might be a simple fix and nothing to worry about. They could just fix it and you're done. However, if there were no coding errors, but you still disagree with this bill you got, this charged amount, you do have a right to file an appeal. It'll be spelled out in your plan documents as far as how you go about doing that. But you can basically appeal with the insurance plan that you disagree with how it was covered, and they might very well take care of it. If you have a Medicare supplement or an Advantage plan, it should be clear as to how much you should have to pay for any given service. But as Lamonica was talking about, the 80% on original Medicare, you're responsible for 20%. 20% of what is a pretty good question. So that bill that looks really high, it might be 20%, which is legitimate. Maybe it was just a really expensive service or procedure. So that could be surprising. Also, keep in mind, this surprising bill might not be a bill at all. So there's something else called a explanation of benefits. So you could get this statement in the mail. It's not a bill, but it will show the full amount the provider charged, the amount the insurance company agreed to pay, and a balance amount. But sometimes these statements can be hard to read and misinterpreted as a big bill. Last thing I'll say about the unexpected bill might be from a hospital stay. So if you ever find yourself in the hospital, maybe you've stayed overnight or a couple of nights, you were in a room, you were in a bed, you felt like you were an inpatient in the hospital, but you might actually have been considered in observation status as opposed to inpatient. So even though you felt like you were inpatient, if the hospital classified you as or coded you as being under observation status, you're going to see a big difference in the amount you're billed and the amount you want to pay. So hospitals are supposed to tell you if you're under observation or inpatient, but it's always a good thing to ask on the front end, am I admitted as an inpatient or am I under observation status?
This is good information. I appreciate this just for myself. But any closing thoughts as we kind of come to a close? Any closing thoughts from Lamonica or David as well?
David?
Yeah, I'll just say, if you're like most people, you probably didn't retain a whole lot of this information that we talked about. It's most people don't wake up in the morning and say, yes, today I get to learn about Medicare. But I would just say, don't get too overwhelmed with it. If you're in a plan and you're happy with it and not much has changed with your situation, then you're pretty good. If you're coming into Medicare and you're brand new to it, don't get too overwhelmed by all the information you get. Ask your friends and neighbors if they have someone that they trust that helped them with their Medicare. Lamonica helps people every day, all day, every day, go through this. And everybody's situation is unique, so your neighbor or your friend who's on Medicare has their situation and their plan, and it might be perfect for them. You're you, and you're not going to be exactly the same as anybody else. So find somebody that you trust that is knowledgeable about how all of this stuff works. Local to your area really helps. They might even know your doctor personally, and they'll be able to walk you through it.
That's good. Well,
absolutely.
Well, thanks you guys so much for taking the time and just giving some value to everyone. If you guys have any questions as you're listening, please don't hesitate to reach out to Lamonica Thomas. Her number is 972-249-8907. Also, her email is lathomas55@gmail.com. Thank you guys so much for taking your time.
That's it. Thank you. This was great.
All right. Thank you. Thanks for listening to Healthcare That Cares. For more information about Charlin, visit charlin.org. That's CHARLIN.org. And follow us on social media, Facebook, Twitter, LinkedIn, Instagram. Our handle is Charlin Health Services. God bless and see you next time.